Hi everybody, welcome to our Sun Safety presentation through Cancer Prevention in Action. Thank you all for coming, and I just want to introduce Ginger and Vicki, who will be talking to you all about our Sun Safety initiative along with our cancer prevention policies.
Thank you, Missy. Hi everyone, how are you? Very good. Thank you very much for your time today. We sincerely appreciate the actions against cancer that Montgomery County has taken. These are very significant in the respect that it's a cancer prevention package of policies that could actually help improve the health and the wellness of your workforce. So this is very important. I'm going to get right after it. I'm going to use the screen because I think this is so awesome. It's such tech savvy. So this is a partnership that we worked very hard with and we collaborated with for quite a few weeks prior to rolling everything out with Nicole and to Missy. So I want to extend a sincere thank you to both of you and really leveraging all of the different aspects that needed to come to make these policies happen. So thank you both very much. I think I just... So our Cancer Prevention and Action Program seeks to prevent cancer in our community. We work throughout Fulton, Montgomery, and Schenectady counties. 268,000 is our population that we cover. We promote local policy systems and environmental changes which take action against cancer. Is anyone familiar with PSE change, policy systems, environment change? So in this room right now, I always liked, Jeff, you're not allowed to answer this question because I know you know the answer to this one. So we're going to see if everybody else knows this one. So in this room is one of the greatest policies that has ever been implemented. In 1973, the federal government put in a policy into effect that will greatly reduce fire-related injury and fire-related deaths. And it's a policy systems environment change. Does anybody know what it is? It's in this room currently.
Sprinkler system.
You're on the right track. You're close. It's a smoke detector. Smoke detector was a policy systems environment change that really improved the lives of everybody across the nation and has been widely accepted as a social norm. So that's what we're trying to develop today, is a social norm towards preventing cancer. So about cancer. Cancer is the second leading cause of death in the United States. 120,000 New Yorkers, that's 2 New York Yankee stadiums, will learn that they have cancer this year. But did you know that 42% of these cancer cases could have been prevented? 42% of cancers could have been prevented. So this is our mortality rate. If anybody wants to, you can just jot this down, but this is for Montgomery County specifically. And if you look at the definition of cancer, it's abnormal cells that grow out of control and they form masses known as tumors. And the very beginning of that sentence is abnormal cells. This is what we're trying to prevent. What can we do to protect the cells? Shield the cells, keep those cells from growing out of control. We can know our risk factors, and then we can know our prevention efforts. And this is what Montgomery County has done. They've implemented some prevention efforts. So together we can take action against cancer. So the risk factors of cancer. Number one risk is age. As we age, our risk factor increases. Race, you want to look at access, and it historically is known that access to care for certain races is definitely an issue. Family history, you want to look at first generation, a sibling or a parent. Genetics, we can look at your DNA. It carries instructions to make proteins or several proteins that can change and form variants, mutations, or alterations in cellular form. Immunosuppression therapies, organ transplant patients or HIV patients, they're at higher risk. Cancer-causing substances in the environment, asbestos, formaldehyde, radon, and all of our sources are through the National Cancer Institute. Hormone therapies, for example, oral contraceptives, birth control pills are a risk factor towards cancer. Menopausal therapies. Infectious agents from viruses or bacteria illnesses. Epstein-Barr virus can cause lymphoma if it's not treated in a timely manner. Same thing with hepatitis B, hepatitis C viruses that can lead towards liver cancer. The HPV virus can bring on 6 different cancers if they're not treated, and H. pylori bacteria, which can cause gastric or stomach cancers if they're not treated. Risk factors can also include lifestyle behaviors, alcohol consumption, smoking, UV exposure, or obesity. So one of the benefits that Montgomery County has now implemented at the beginning of the year, and it's an actually outstanding benefit, is you've expanded the paid time off benefit for all employees to 2 4-hour banks of time to get a cancer screening. So about cancer screenings, nearly 1 out of 5 deaths in New York State is due to cancer. Your health is a priority, and this is what Montgomery County has done. They're making your health a priority. Some cancers can be found early or prevented through screening tests. Screenings can find cancers early when they may be easier to treat, or when some cancers before they even start. Early detection of breast, cervical, colon, lung, prostate, and skin cancer can dramatically improve treatment outcomes and save lives. These are the only cancers right now that have screening tests that are through the United States Preventive Services Task Force. These are the agencies that determine the criteria for cancer screenings through a lot of rigorous testing and regulations. So that's who we follow. CPIA advises you to talk to your healthcare provider every year about what cancer screenings are best for you and when you should have them throughout your lifespan. We understand that becoming an employee with Montgomery County really is an outstanding, I almost want to say like it's a privilege, because you have so many wonderful benefits that you're offered, and they follow you throughout your lifespan. And this is one of the things that can do that. This benefit can now help you follow prevention for cancer throughout your lifespan. So Montgomery County is taking action against cancer. Montgomery County employees are afforded 2 4-hour banks of paid leave time without charging your leave credits each calendar for the types of cancer screenings. They will not carry over to the next year. So if you don't use it, you lose it. So it's a good opportunity to take advantage of that time. These screenings include physical exams, blood work, skin checks, and other laboratory tests for the detection of cancer. A doctor's note must be provided for each appointment, and this note should be given to your department leaders or your timekeepers for the time to be charged to your PTO bank. For a written copy of the policy, you can contact your department head or your HR. And I just want to share the cancer screenings. So for women, we advise that women ages 40 to 49 should consult with their doctor about how often to get a mammogram, and all women ages 40 to 74 years are at average risk of breast cancer and should get a mammogram every 2 years. That's this group, 40 to 74. You want to think about this every 2 years. Most doctors will tell you to have it done on a yearly basis because the changes are rapid fire. So always have that conversation with your doctor to determine what is best for you. Same thing with cervical cancer. All women between the ages of 21 and 65 have that conversation. Those that have not had the HPV vaccine should consider cervical cancer screening exams a little bit more often. For men and women ages 45 to 75, this was just changed. That's why it's always important to check this site, the United States Preventative Task Force. They can change this on a regular basis because they're constantly trying to bring in the new research and the latest information. So that was recently changed for colon cancer screenings. It's now 45. It used to be 50.
Must be when you get 75 they write you off.
I know. They put a cap on it. I know. I always say, you know what, you can have a 90-year-old mom, and if she needs to have a test done, let her do the test, and the doctors will always support it. Yeah. I know. So another one that has come up, and I highly recommend this one, is the annual screening for lung cancer with a low-dose computed tomography, which is an LDCT, in adults aged 50 to 80 who have 20-pack year smoking history and currently smoke or have quit within the past 15 years. Have the conversation with your primary care doctor. If you think that you have any sort of a category that leads towards lung cancer, they can work with you on that. And lung cancer right now in Montgomery County as well is the #1 cancer killer for both men and women. The numbers on the lung cancer deaths are really hard to capture to reduce that. So this is one method that we're incredibly proud of. This is done locally too at our local hospitals. So we advise men ages 55 to 69, but you can go past the 69, that you should discuss the benefits of the prostate-specific antigen, the PSA blood test, with a healthcare provider for prostate cancer. Blood test is right now the recommended test exam for this, and you should have that done on a regular basis, and then you can see if there's measurement changes. And then you can do a self-exam by patient or a clinical examination by a healthcare provider, which can be used for the screening of skin cancer. Regular skin checks by a doctor are important for people who already have skin cancer. This I can't stress enough. You're going to hear me talk about this a lot more as we go on, but skin cancer right now is the most common cancer, hands down. So if you need to have something that looks a little unusual and you want to have it checked, make sure you talk to your doctor about that. Okay, does anybody have any questions about the paid time off for cancer screening? I guess it's really important to have that discussion with your provider to see which one's best fit, but we're going to get right into the sun safety education. And this we worked really hard on. So for the sun safety, we're just going to share a couple of basics on the UV radiation. There's 3 types. There's UVA, UVB, UVC. UVC is stopped in the ozone, doesn't even touch us. UVB can give you burns and skin cancer. It can penetrate the outer layer of the skin. It's strongest between spring and fall, 10 to 4, but it's still active all day, okay? And in the winter, you can get sunburn, especially if you're in snow with that reflectivity, but we'll get into that a little bit more. UVA is the strongest ray when it comes down. This is for aging, wrinkling, skin cancer, penetrates deep into layers of our skin. It can pass through windows on glass, and it is really important that you prevent this all year at all times if you can. UVA is the strongest. Once again, I will say that often. That's the one that you're trying to really prevent. Okay, 1 in 5 Americans will get skin cancer in his or her lifetime. It's the most common cancer. Ultraviolet radiation is a risk factor for cancer all across the board. These are the 3 types of skin cancer: basal, squamous, or melanoma. Some people say squamous. Same. Tan skin is damaged skin. You're altering the cells. When you're tanning your skin, you're changing the dynamic of the cell, and it's becoming an abnormal cell. Men are more likely than women to get skin cancer, as they are more likely than women to work outdoors. Okay. So don't sunburn. 1 blistering sunburn more than doubles your risk of skin cancer. In children, this is incredibly important. 1 blistering sunburn, it will change their dynamic, their genetic makeup on their cells. UV radiation can penetrate clouds, light clothing, windows, and windshields. Example is trucker's arm. There's a lot of studies right now that are showing the left arm on truck drivers have a higher increase of skin cancer. UV radiation is 4 times stronger on reflective surfaces, including blacktop, concrete, metal, especially if you're on roofs or doing any sort of roofing project, sand, and water. Water is very big. When it comes down, it comes back up into your face, and the reflectivity is more. It's 4 times stronger. So skin damage from UV exposure adds up over time, increasing the risk of skin cancer as we age. So this is the UV index. I love referencing this. I do this often in my emails. So UV index, the green, the yellow, these are all the different levels that they offer. When you get into an 11 plus, this is usually in August where we start to see that. So less than 15 minutes is when you can get your burn. So I always look for this and then for the time. But I will actually send a copy of this to Missy, and I'm sure you're going to see this on some of her Wellness Wednesday activities because they're awesome. But this is a really good tool. If anybody is working outside on a regular basis, it's really a good point to educate your teams or the leaders of your teams about the UV index, and you can encourage them to use some of the Sun Safety Award products that we're going to share with you today. So we're really excited about that. Oh, did I go the wrong way? Oh, no. Oh, no, I did. So you can take action against cancer while you work. Schedule your work tasks around the UV index if possible. We understand that it's not always the case, but for example, if you've got a tree down and you need to, chop it up and move it from one place to another to get it out of the roadway, maybe you can think about doing that early in the morning when it's a little bit cooler and not so strong. Share the UV index with your team, especially your team leaders. Try to increase shade when possible. Identify locations at your work assignments within that location to use the shade. So if you're doing construction or working in one certain area, maybe there's a spot at that site where you could put a portable tent. Oh, we've got tents for you. So there's a lot of tents. These are portable tents. They're just from the local big box store, but they do a really good service where they can increase shade rapid fire if you need to. So you can provide portable tents. They're also good for mobile units. So they do fit in fire trucks. And if you have any sort of emergency vehicles, you can always throw them in the back of the truck or someplace where if you're on an extended call, you could use them. If you have like a missing person search and you're in one area for a long period of time, that might be a place where you could think about putting that type of a product. So provide these tents for tabletop outdoor work assignments. So for example, you have some carpenters that have to do some woodworking, put the tent up, and then you can do the table and do the saw work afterward or underneath the tent. Or for long emergency calls or trainings. Always recommend this on trainings. We actually did an experiment too with a training for one of our local fire departments that used it, and we put the tent up and we walked away from it. And within that training, it was maybe 20 minutes, more and more people started to go under the tent because they felt that they were burning up and they wanted to get out of the sun. So you will gravitate towards the shade if you put it up for them. Use umbrellas on open seat equipment, especially the cat umbrella over the operator. So is there anybody from Highway here? Okay, so the Highway Department is receiving a cat umbrella. It's a Caterpillar umbrella, and it will sit directly over the operator so the operator doesn't have exposure anymore. I did it again. These are all for, I went way back. Wow, aren't you sensitive? I'm going the wrong way. Sorry. I'm so sorry. Okay. So that is really important. Like the New York State Thruway currently made this mandatory, and it's on all of their open operator equipments. They have those umbrellas, so they're really nice. Provide portable shade for long duration emergency calls, and then take breaks in outdoor shaded areas when possible. So let's talk about that. If we come over here, we have some shade sales in these wonderful colors and all the hardware. And every Montgomery County building is going to receive a set of these shade sales to increase shade outside, so you can take some outside breaks if you want to for your workforces. So I thought that was really fun. It'll be a nice, relaxing piece where you can get out of the culture of noise that we all seem to be surrounded with, but it would help. Bye. That's it. I give up. No, I'm not going to give up. It's a challenge.
Do you want the clicker?
I didn't know there was a clicker.
There is a clicker.
Right up on I think on the podium. There might be.
Oh, well, we're good right now. Thank you. Okay, so sunscreen. So let's talk about sunscreen. You can apply sunscreen SPF 15 or higher on all areas of your skin, exposed areas of your skin. Every location is also going to be receiving a sunscreen dispenser. So if you want to go for a walk on your breaks or at your lunchtime or something, you will now have that accessibility. And you can also apply it in the morning when you come in, if you're going to be out and about, if you're an employee that's out in the field. Use a palm-sized amount and reapply every 2 hours when in direct exposure. And we have sunscreen towelettes available for mobile units. This is great for equipment trucks, on toolboxes, and patrol vehicles. So this is what these are going to look like. These are really cool. So it's a mixture of sunscreen and a towelette together, because when you use sunscreen for a while, like I have, the inside of your car will turn white. But that's okay, because we're being safe. But sunscreen, it does provide your hands can get a little bit sticky, so that's why we gave you the towelettes. So there's a lot of these. I think there's 20 boxes of these, and we're gonna split them up, and I know 10 boxes alone are going to the Montgomery County Sheriff's Office for all of your units to make in your portable, in your patrol cars or your canine units, wherever they need to be, so they have access to it if they need it. And they're really good, especially if you're working in surfaces that are reflective, asphalt, concrete, metal, sand, or water patrols, things like that. These are the types of products I think would be really beneficial, but you want to make sure that you're washing your hands after you apply sunscreen, before handling any food, power tools, any weapons, things like that. So that's what the towelettes are for, really, is to make sure that you're cleaning your hands off properly. So really excited about that. And then you can increase your PPE clothing to cover up unprotected areas of your skin. Wear wide-brimmed hats, back of the neck coverage, full face gaiters, neck gaiters, long sleeves, UV sleeves, and long pants. So the Skin Cancer Foundation recommends these UV sleeves. And this is what the athletes wear, the pro athletes. So this is a UV sleeve. Highly recommend them. This is a UPF 50. And they slide right on. I use a rash guard most of the time. But this is what you can use to protect, especially if you're going to be out in the cars for a while and you won't get that trucker arm. You can wear one arm, you can wear both. If you're working the fair, that might be a piece. But there was about 40 of these purchased specifically for the sheriff's office. It's a piece that might be beneficial to some of the team, but there's also some in reflective colors that was purchased for DPW, as well as the highway teams. And then for the highway teams, we have a mixture. So there's these types of hats. There's this type of reflective hat that was purchased. The sanitation department wanted full face gaiters. So we had a safety meeting and we had a moment to speak to the leads in the departments, and they actually requested this type of a product because they're in areas that might be a little bit more challenging, and wide brimmed hats, they want to be able to keep them on and not fall off. And then for the highway teams, there's these types of products, which can really just adhere right to the hard hat. And we are seeing more and more people use them. So lots of these kits were purchased. And this includes, I'm trying to get it out, sorry. The UV sleeves, as well as a neck gaiter. It's all one kit. And then this piece adheres to their hard hat, and it protects the back of their neck, and it comes right up over the top. So it's a great piece that does provide that extra level of shade, for personal shade on their faces. There's also a bunch of these hats that were purchased for the landscapers, and this will be great if they're out in their tractors or the lawnmowers. And then we're going to get into one other piece. Let me see here. This is right. Okay, so sunglasses, UVA and UVB protection. Can't stress this enough. Sunglasses, if you don't wear sunglasses, your eyes can get damaged with eye cancer, premature cataracts, sunburned eyes, growths on or near the eye. Red eye is a sign of sunburn in the eye. Premature cataracts, we're having people come in their 30s with premature cataracts because they've got some exposure. So you really want to be mindful of that and encourage sunglasses as much as you can. And there was sunglasses also part of the award. So you want to make sure that you're getting the UVA protection as much as possible. Okay, and then we have lots of products that we've made. We're going to continue to do that. So I believe that some of the products are already mailed out. You're going to see some communications coming out in your Wellness Wednesdays. So Montgomery County is taking lots of actions against cancer. You've got your paid time off for cancer screening, so you can really schedule them out when you need them. Talk to your doctor about which one is best for you. can practice sun safety behaviors while outdoors. If you're in a leadership role, doesn't matter what level, whether it be at the top or mid-level, we encourage you to encourage your teams to practice sun safety on a regular basis. And then continue to review the communications that are coming out through your employee portals or your Wellness Wednesdays. A lot of products are being mailed to your home. So they're really making a strong effort here. And I want to thank them all for the hard work that they're doing, because it has been a wonderful project. And I really think it's going to have a great impact for the entire workforce for Montgomery County. Does anybody have any questions about anything, about any of the products?
Nicole, I have a question. The 4-hour lead time is up to 4 hours,
It was up to 4
correct?
Correct. 2 4-hour
Two.
banks.
Right, but
Yep.
it's up to 4
Yep,
hours.
up to 4 hours.
Yep.
In other words, if they leave New Hampshire and their appointment's at 8:15, and they're done by 9, they can come back to work.
That is, yep, that they,
Just wanna make sure.
if you wish
The
them to.
employees who want to kill me right now, but I wanna make
Yeah.
sure, because that's the game that will get played in the jail, for sure.
Get an outstanding hours somebody use? In that case, like.
No, it's not like it's not a bank, it's really, it's per 2 4 hours, so if you use 2 hours of it, it's really, I think that's how we've been doing it.
Right, that,
Yeah.
if you go to a cancer school appointment, even if it takes an hour, that 4-hour block is gone.
Rachel, do you?
I was gonna say I don't.
I'll
think
have to
so.
get back to you on, that. So I just wanna double check how it's been happening.
Well,
Yeah.
I think like for the mammogram, like if someone goes for a mammogram and they only use an hour because then they have to go back for like a biopsy,
Yeah.
then they're able, Kathy, I
To
believe,
use the rest of it?
to use the rest of it. But that's for that one, not necessarily this additional.
Right.
Yeah.
I can send out some additional clarification, like Tristan was just saying that some people that may go for a mammogram, they may get the diagnosis, they go for that screening, and then they're going for additional testing on it, they may use the remaining hours of that 4 hours for that additional testing. I'll double check and I'll send out correspondence.
So I just want to share too, as part of the award, over here there's a custom tent that is for the Montgomery County Sheriff's Department, and on that tent it's got a shaded wall. So what's nice about the wall is it can be moved on the tent, so you can put it on the back of the tent, you can put it on the sides of the tent, however you want that. But and then the rest of their award, I believe that's all here.
Yeah.
We've also hired a media production company, and we're going to be creating a video asset for the county about all the different strategies that you guys are implementing to reduce cancer. And that will happen after all the shade sales and the sunscreen dispensers are up and implemented. But we'll always give everybody a heads up as to when they're going to be filming. You might see a drone here or there, but we'll definitely let everybody know. And there's a couple other small pieces. We're making Missy some wonderful branded assets for the wellness efforts. And everybody gets lunch today, so please make sure that you take your lunch with you. But does anybody have any questions?
We are still looking for volunteers to be in our video production also, so.
Yeah, so just let Missy know if you're interested. And that won't take place until probably the beginning part of June.
As far as the products, where's a reliable place, I guess, to go get them at? The good quality or?
So Missy has them all.
But for personal use,
Oh,
like
for
I know.
personal? Oh, so you know what? Anything is better than nothing. So you can get them right off of Amazon. The sunscreen is probably one of the most expensive pieces, and I would always go for a trusted company or an accredited company when you're purchasing that. We use SunStation USA. That's who we purchase our products through. When you're going into the regular local store, you want to look for mineral-based sunscreen. I think that's a better choice, especially for children. If you're going to be out in the sun for a long period of time, do an SPF 30 or higher on the neck and the face, but then use the SPF 15 across the rest of the body, unless you're out for a long period of time. I prefer to cover up. Sunscreen can be a challenge because you have to reapply every 2 hours, right? Because it does wear off. Any other questions? All right, well, thank you all so much. I appreciate your time, and hope that you enjoy your summer safely, but thank you all very much.
Thank you all for coming, and Missy's gonna do a drawing for a prize because you guys attended. Not only do you get lunch and water bottles, but something else. Yeah.